Okay, Caroline, tell me about your job title and like just your job description.
An MRI assistant, and I do everything for the techs. The only thing I can't do is I can't scan the patient.
You're the one that gets them to sign their consent forms.
Yes.
You go over the questions with them, correct?
Yes.
Do you do any kind of history taking? Like, do you ask them about their issues?
Yes. So when we go over the forms, I ask them all their surgeries they've had, ask them if they have any metal in them, ask them if they have stimulators, pacemakers, anything like that. If they say yes and we don't know about it, then that's when we do deeper research.
You ask them about like what kind of issues they're having, like problems like pain.
Yes. So at the end of it, when we ask them everything else, we'll say, "You're here for this. What's going on?" And they'll tell us all their symptoms. That's what we put in the notes.
Before you even bring the patient back in the room, do y'all compare previous exams? Like, do you look and see what they've had done before this?
Yes. So our MRSO Cody, he goes over everything before the day even comes of their appointment. The day of their appointment, Dana Molnex, who gets here at 6:30 before patients are even scheduled, she comes in. I order everything the previous day. When she comes in, everything's ordered. She goes over everything, profiles everybody, and figures out if there's something that we didn't know about.
Okay. Say a patient comes in and they are complaining of ankle pain.
Okay.
But y'all have an MRI foot ordered. Okay. Doctor ordered MRI foot, explains to you that a patient dropped something on her foot, but she's really just set on it's her ankle that's hurting. Is there anything from y'all's perspective that y'all can do to maybe try and get that order modified, changed? How do y'all go about that? Or do y'all just scan what was ordered?
Depending on the complaint versus what was ordered, we can either call the doctor's office based on what the patient's telling us, or if we can't get in touch with the doctor's office, we'll scan what we have ordered and do what we have ordered, but we try our best not to have to make patients come back.
Maybe the patient did get an MRI ankle ordered, and she's complaining of this ankle pain.
Okay.
And say it's been going on for 2 years.
Okay.
And y'all keep rescanning this woman's ankle, and there's no results. Like, it's a negative result every single time, but she's still complaining about this pain. Is there a way that y'all change your history taking? Like, do y'all ask her different questions? Do y'all try and specify more questions? Or do y'all try and maybe suggest a different test to see if it's something else?
Yes and no.
They come in for an ankle MRI every 6 months. Still, it's a negative result every single 6 months. Is there anything y'all change in how y'all like take notes or anything?
We ask if there's any new injury, anything like that. She's been having increasing pain, if it's gotten better, if she feels it's the same. We ask them questions based on what we're doing. If it's a follow-up, anything, like if she has it every 6 months, every 3 months, anything like that, we'll ask if it's a follow-up, if it's any new symptoms, any new pains, any new injury. If there's not, we'll continue on with what the order that we have is. If not, or if there is something different, we'll try and contact the doctor's office.
But overall, you don't really change how you question her. It's like, it's pretty routine.
Yeah.
From that point. Kind of explain to us in simpler terms what the difference in an MRI brain and an MRI internal auditory canal is.
Okay, so an MRI brain shows your entire brain. We do multiple different planes in the brain. The difference between that and the IECs is the IECs is strictly just your auditory canals.
You see MRIs, probably 30 of them a day. As they come up on the screen, y'all looking at them, and y'all see them so much, you normally can kind of see pathology just based on how often you see it. You know when something's not right.
Right.
Do you think that if somebody is getting repeated studies, it's possible to miss a very obvious pathology that many times?
It's very possible, depending on the body part. Most of the time, no. It's going to be seen. If they're having the same study over and over, they're probably just monitoring that one spot. If there's a specific complaint, like let's say we're doing a brain and there's a known mass that we're checking up on, there very well could be something very small somewhere else that could be missed, but that would be on the radiologist himself, not strictly us.
It would be on the radiologist for missing it.
Yes.
I guess what I'm asking you is, from what you know about MRI, do you think this is an ordering provider's issue, or do you think this is a radiologist issue? is a tech issue,
Mhm.
even if it's multiple parties, who do you think is at fault?
It should begin with the ordering provider. He should not have ordered multiple of the same exam if something was not being found. He should have asked more history if she was having dizziness or anything like that. It very well could have easily led him to the IACs.
Maybe even localization of the pain would
Right.
have helped.
Right. That could have led to the finding of, hey, we need to look at the IACs, see what's going on. If the original MRI brain was not with contrast should have been added because you probably could have seen a hint of something. But from that point, that should have been a radiologist call, and it should not have been missed multiple times.
Okay. So you think that if the radiologist saw 2 negative results in a row, because radiologists do, they go back
Right.
and they're supposed to compare
They
previous
do.
studies.
Yes.
So you think that if they saw that second one,
Mhm.
they should have been like, hey, let's add contrast or let's do
Yes.
something different.
It
The
should have been
radiol-
recommended.
Okay, the radiologist does have that kind
Yes.
of power though.
At the very bottom where it says impression, it says it's a brain, it'll say further enhancement with contrast should be recommended.
From a tech assistant or a tech's perspective, how many MRIs do you think it would take with a negative result to put a red flag up for y'all? Like, because MRI brains are long.
They are.
They're long and they're scary for
They
a
are.
patient. So for this patient to be going through this over and over and over again, how many do you think you would have to see on their history 6 months apart before you're like, hey, what's going on?
Right. With something being negative, we always raise a red flag of why are we doing this again? If they're having the same symptoms, at that point, if they still want it done, we're gonna do it. We have an order for it. They're here for their appointment. They want it done. We're gonna do it.